Being pole skinny now is out, apparently. The curvaceous figure is all the rage. Now, you've only got to look at some of the it girls, Kim Kardashian, Christina Hendricks, and you see that fuller figure is back. Now, women around the world are looking for new ways to make their bodies more bootylicious. To tell us about this morning, cosmetic surgeon Dr. Anoop Rastogi. Good morning, Anoop.
Good morning, Kerri-Anne.
In your practice, have you noticed this trend for women wanting the fuller figure?
Oh, very significantly. We really are seeing quite a significant increase in the number of women who are wanting bigger implants, and the women who are asking for bigger implants are asking for significantly bigger implants, which is surprising.
So it's not any breast augmentation, but what about the rest of the bootylicious?
Oh, okay.
Or that just comes with... The junk comes with the trunk.
It does, yeah. I mean, we're seeing an increase in weight within the community anyway. But even slender girls, you know, their modern icons are much fuller figured and they like it. And, you know, I guess it's a healthier look anyway, as long as we don't go overboard. Okay.
There are new developments.
Yes.
Breast implants have been around for a long time.
Yes.
What's coming out of Brazil?
Oh, okay. Now, there has been an absolute revolution in the breast implant industry. We've always had good procedures and really great outcomes, but the new implants that we've got have a 10 times lower risk of complications than previous implants. So I've got one here for you. Mm-hmm. This is affectionately called the furry Brazilian, or the why would you use anything else implant.
Is that what they call it?
Yes.
The why would you use anything else implant?
And basically, if you look at the three most common problems from a breast augmentation, the implants going hard is the one that kind of everybody knows about, and it is the #1 complication. The risk of that's 10 times lower with this. Mm-hmm. The second thing is, particularly when we're talking about bigger implants these days, premature sag is the #1 issue with a heavy implant. And again, these sorts of implants stop that premature sag. Mm-hmm. Displacement of the implant for it to move into a place where we don't want it is the third risk. And again, that's stopped by these. And what it is that if we look closely at the implant, mm-hmm. It has this material coat. It's actually a polyurethane coat on a standard cohesive gel. And that polyurethane coat keys into the body and makes the implant stick, like it's what we call the Velcro effect. So it actually doesn't exhibit weight, which draws the breast down, and that's how it stops those. Capsular contracture is by a different mechanism, which stops the way that the scar tissue would form around the implant.
So new technology, everybody's impressed with it. Who's actually having these procedures? Is it mothers after they've had their babies, because clearly breastfeeding doesn't do a woman any favours? Who is having this? It is the most... Am I incorrect in saying, and we're looking at some before and afters
these are a couple of my patients, and you can see from here, lovely figured young woman. The breast really enhances a figure there, and you can see it's quite a large implant.
And it's also a balance thing. Is that why women have it?
Exactly. In fact, if we looked at that last patient, she had quite a fuller buttock, and the breast balanced the breast with the buttock to improve the shape. This is an example of somebody who's had a baby, breasts have fallen, and the implant's able to lift and balance the figure back the way that it was. Mm-hmm. Another one again, a younger lady, not had children, just wanting that size proportion.
Is it complicated if you're going to go on and have children after breast implants?
Okay, interestingly, once upon a time I would have said definitely yes, because obviously the breasts change after breastfeeding, mm-hmm. and if you've got a greater weight in there, it's more likely to come down. With the newer implants, it actually keeps the breast up, and so it is not the disadvantage that it once was. Mm. In terms of who has it, it's all of the above. Yeah. Young girls who are wanting to proportion their figure, girls with different shaped breasts.
It's not the taboo subject it was.
Not at all. There is an explosion in the number of women having breast implants.
Well, Anoop Rastogi, thank you for talking to us about the revolution.
Pleasure, Kerri-Anne.
Appreciate it. All the best from Dr. Anoop Rastogi.